Missed an episode of your favorite podcast? Choose from over a decade of content in our archives, not just the latest episode. All free at GCNlive.com.
This is your call to action. Get prepared, America. Economy, survival, energy, disasters. This is USAPrepares.com. Informative radio, educational radio. Interact now by emailing instructor@USAPrepares.com or text at 434-390-7953. Class, please take your seats. Now, your instructor, Vincent Finelli.
Everyone all set, cocked, locked, blissed? Dr. Shealy, are you blissed?
Yes.
Me too. Dr. Shealy, I've got a copy of your book. I was able to find it. It's over 31 years old, or 30 years old. It's 90 Days to Self-Health. 90 Days to Self, Health, by Dr. Norman Shealy. I've got your third printing of this. And it was 1980 is when it was printed. Fabulous book. I hope we'll have a chance to talk a little bit about that during the broadcast. Do you have anything that you would like to share before we get started?
I'm open. Open line.
Okay.
Monday.
Okay. Oh, how's your radio show going, by the way?
Well, it's going well on Wednesday afternoon now at 4 p.m. on KICK.
Okay. KICK, that's out of Springfield, Missouri, AM 1340. And that's a great little radio station. It really is. And when I say
very
little,
nice place. A lot more friendly.
Yeah, and what I meant by it's a great little radio station, it's at 1,000 watts. And there are 1,000 watt stations throughout the United States. And their job, as defined by the Federal Communications Commission, is to broadcast local. What's happening locally. And that is their mission. So KICK is one of those AM 1340 stations, and they do a fabulous job about what's happening in the area. And Sunny Skidmore station, KLID, is an AM 1340 as well in Poplar Bluff, Missouri. So even though they're on the same frequency, the distance that separates them prevents the signals from, clobbering each other. And it's a great way to go. So class, if you are, interested in what's happening locally in your area, your neck of the woods, regardless of what state you're in, you might want to try tuning to AM 1340. There's a station that will probably reach you no matter where you are, and it will be local. So, and that's, and they don't have these are smaller stations, and they don't have the large staff where people get lost. Their focus is local. So that's why I said it's a great little radio station. And I'll bet you find it really comfortable there. I mean, you probably met everybody, right?
Oh, yes.
Okay.
Yeah, very friendly.
Yep. And that's where Vin Finelli got his start on, KICK, AM 1340 in Springfield, Missouri. Dr. Shealy, there's an email that I got from one of our instructors, Kathy in Ohio. And Kathy teaches us about home economics. She is our domestic engineering instructor. And she sent me an email that says, Vincent, and this was over the weekend. Vincent, I believe my dog has a UTI, urinary tract infection. She has been leaking urine. I'll try to call my vet tomorrow, but I wondered if you or Dr. Shealy may have any help for me. She's been leaking some last Sunday and a little on Monday. She seems to be better, but the leaking is a small amount of urine. She's eating and playing. I increased her fluids. I added Greek yogurt and gave her some apple cider vinegar for about 4 days. I was just wondering about home remedies, and she'd like to avoid antibiotics if possible.
Well,
and that's from Kathy in Ohio.
That urinary tract infections in dogs are similar in some extent in those in people. That means they're usually E. coli, and the treatment of choice of that would be D-Mannose, M-A-N-N-O-S-E powder. If it's a powder, 1 teaspoon a day, the E. coli likes the mannose better than it likes your bladder. And theoretically, about 95% of all urinary tract infections in people at least are helped adequately by D-Mannose rather than antibiotics.
Mm-hmm. And we've discussed D-Mannose, and let me spell it one more time for you, class. Dr. Shealy spelled it, but it's the letter D hyphen M-A-N-N-O-S-E. D hyphen M-A-N-N-O-S-E. And I thought that for our preparedness medicine cabinet, that we should have D-Mannose on hand so that if someone does get a urinary tract infection, we'll have it ready to go rather than try to find it at a store or get it on the internet. And it's very inexpensive. I don't remember exactly what the price was, but less than $20 for sure.
Oh, yeah.
Do you think that...
By the way, if you're ordering it online, get it in a bottle, not in a bag.
Mm-hmm.
If you get it in the bag, it gets clumpy. But if you get it in a bottle, it's much easier to take a teaspoon, that kind of thing.
And
now,
okay, please continue.
My favorite company is NOW.
Yeah, now NOW as the provider, and that is that's the brand name, if you will, of the manufacturer of D-Mannose. So I'm looking at D-Mannose right now, and $13.49 for 500 milligram veggie capsules. And you can buy it for $17.47 also in bottles. And the one that I have is blue in color, so obviously they want to protect it from light damaging it. So, Dr. Shealy, do you think that that's something that we should have on hand at the ready, D-Mannose?
Oh, yeah.
Does that make sense, or is that a waste?
Take that as a first sign of burning, irritation that feels as if you're getting an infection in the bladder.
So the symptoms of a urinary tract infections are burning while urinating?
Yeah, burning and urgency.
Okay. And what would the course of taking D-Mannose be? How many days?
At least a week.
Okay. All right. So did you say 1 teaspoon of the powder?
Right.
Okay. Now the bottle that I have says 1,500 milligrams. There's 180 capsules in here, and it's 1,500 milligrams. Do you think that's about the right dosage once a day?
Right.
Okay. So there you have it, class. The course is for 1 week and 150 milligrams or a teaspoon if you have a powder. And do you take it with water, or what do you take it with?
Water. It has no flavor.
And what about those who eat sugar? Should they avoid eating anything that is...
People who eat sugar should stop eating. Sugar is not a food. It is the most unnatural product in the world.
Yeah. And the reason I'm asking, if a person has a urinary tract infection, will consuming sugar prevent D-Mannose from working properly?
Well, it will make it much harder because the bacteria love sugar. Viruses love sugar.
Okay.
Everything loves sugar except your mind and body.
And that was, that was one of my questions about sugar. Now, we know that opioids are addictive. We know that tobacco is addictive. We know that there are lots of things that MSG, makes you want to eat more. Whatever MSG is applied to or sprinkled on or laced into, we want to have more of it because it sets our taste buds into a frenzy. So we want more of whatever the MSG is in or on. Well, what about sugar? Is sugar addictive?
Yes, extremely.
It seems like, yeah. Mm-hmm. And Okay. And if it's that addictive, should it be labeled as a drug?
First, I think it should be labeled as a poison.
Mm-hmm.
It is not a food.
Yeah. And for some people, it's almost impossible for them to walk away from sugar and bread. I wonder if, well, bread has sugar in it, right? A lot of bread has sugar in it.
Right.
So, did we evolve to this point or devolve to this point where we think that sweet things are good for us, things that have colors are good for us? Because the manufacturers, and I was thinking about this over the weekend, the guys that make taffy, there's a lot of sugar in taffy. Saltwater taffy is what I'm talking about. But there's the red stripes, and there's the pink taffy, and the yellow taffy, and then the brown taffy, and then there's black taffy, and the green, blue. There's all colors, and those are added to the taffy. So somebody has figured out that we should add this additional product for eye appeal. And someone has figured out that by adding sugar to lots of extruded foods, it will have more taste appeal. Have we devolved to the point where we think that that's normal and that our body keeps saying, and go down to the snack aisle, that's where we need to be? And our brain is now confused.
I would call it devolution.
That's what I mean. Devolution. Mm-hmm.
The interesting thing is, it is very easy to become addicted to things if they give us something that we like. Alcohol, for instance, some people is very addicting because they like the detachment, the who cares attitude that alcohol allows them to have. It gets rid of their anxiety. However, it is not a good drug. It's okay as a libation. It is not okay as a drug.
Can you define libation for our class, Dr. Shealy?
Well, libation is anything that is a pleasant drink. It can be a glass of water. It can be a glass of orange juice or apple juice. And, of course, the different strokes for different folks. Taste buds have different desires. Some people have a very strong desire for one particular flavor of beer, for instance. And it's okay. But when you get to needing more than one a day, you're in trouble.
Okay. Very good. We've got Amit in Massachusetts. Welcome, Amit.
Good morning, Vincent, and good morning, Dr. Shealy.
Yes.
I have a question for Dr. Shealy for generally prostate health, in the sense that what can we do so that it doesn't get enlarged as it often happens? And for general prostate health, if anything he can recommend?
Well, there are a number of things that can help. Salt palmetto is the top of the list. Salt palmetto is 240 milligrams 2 to 3 times a day. Pythium, 50 milligrams a day. And if that doesn't work, you also need zinc, about 20 milligrams a day. Now, the average urologist offers something called a TUR, transurethral prostatectomy. To me, it is the most barbarian operation still on the horizon.
Amit, please hold. Amit in Massachusetts has been asking about enlarged prostate and what we can do for men to try to minimize that and avoid it from happening.
Yes.
If that doesn't work,
yep.
Look extremely carefully to find a real urologist who does green laser. Green laser is 1 billion times better and safer and quicker than a TUR.
Dr. Shealy, can you explain what a TURP is for without
it's a corkscrew. It's like a corkscrew going through the prostate. I mean, cutting it out. It's just an unbelievable barbarian procedure, in my opinion. I've thought that since I was in medical school.
What you're talking about is like taking a drill bit, right, and drilling a hole.
Exactly.
into the prostate. And that's because the prostate in men becomes enlarged. And when that happens, the flow of urine is reduced to the point where it's very difficult to urinate, correct?
Right.
Okay. And so saw palmetto, what does that do? Is that reverse?
Well, it helps to shrink the prostate. It actually helps to shrink it.
Okay. And I wrote down your recommendation for taking saw palmetto. I wrote the 2 to 3 times a day part down, but I didn't get the part with the dosage.
240 milligrams.
240 milligrams per day. 240 milligrams 3 times a day. Okay.
Right.
And you also recommended zinc, 20 milligrams of zinc. And how often is that?
One
per
a
day?
day.
One times.
And pygeum, Pygeum, 50 milligrams a day.
Pygeum. EUM, 50 milligrams per day. And that's once a day, right?
Exactly.
And what does that do, Dr. Shealy?
Well, again, it works in cohort with the, these are additive things. You get a little bit more benefit for each one that you add in shrinking the prostate. It really actually helps to shrink the size of it.
Okay. Amit, back to you.
Yes, Dr. Shealy, what can we do to sort of forestall or as a preventive measure that we avoid that going too large? And my second question of curiosity is about the surgery. I have read that in earlier days, maybe the belly was open and the entire prostate was taken out, and that ran a risk of some nerve getting damaged that caused no more erections. But are you also saying that even with this drill being sent through the urinary tract and say taking, if I can use that term, tomato ketchup out, is that still such a barbarous procedure?
Well, I mean, the TUR is the one I consider barbarian. Now, there's a surgical procedure where you actually just take out the whole prostate. That is that is a bigger operation, but certainly is a more normal, if you will, to me, way of doing it. But my strongest preference is always green laser if you can.
Okay.
Amit, why don't we have Dr. Shealy share with us what the green laser procedure is? How does that work, Dr. Shealy?
Well, they put you to sleep, generally, and they put a catheter-type thing into the bladder, and then it right through. It must have must be a sort of a stiff plastic thing, or metal, and then the green laser actually vaporizes the prostate. Instead of cutting it out, it turns it into vapor, and it's just sucked right out. And they leave a catheter in usually overnight, and that's the end of it. And I personally had one done 8.5 years ago. I had to go 3 hours out of town to get it because none of the urologists in Springfield do it. But it was worth it because I went in at 7 o'clock in the morning, and at noon I drove home 3 hours.
Amit, can you stay with us? I've got some more questions, and I'm sure you do, because this is something that will impact about half of us, the men.
Yes, minimum. I'll hold.
Yeah. And my understanding is that if you live long enough, you're going to experience this. So here we go. We'll be right back. Dr. Norm Shealy's with us, medical doctor. Amit's with us in Massachusetts. My understanding, Dr. Shealy, is that if men live long enough, they will have an enlarged prostate. It's like guaranteed. Is that right?
Almost, I would say darn close to 90+%.
Mm-hmm. Okay. And so the things that Amit is talking about, prevention, what do we do?
Well,
if I could joke that apart from the technique of Mickey Mantle that is dying sooner, anything else we can do to forestall that or avoid that. That's all.
I believe what Amit is mentioning is that as Mickey Mantle, New York Yankees baseball player, aged, he said, if I knew I was going to live this long, I would have taken better care of myself.
Well, that's true. And in general, men should start taking saw palmetto and Pygeum and zinc not later than age 50.
And Dr. Shealy, is that in any multiple vitamins? I mean, if someone takes a multiple vitamin,
you have to take them separately.
Okay, back to you, Amit.
Yes, sir. I missed the dosage of Pygeum. I think Vincent, you noted down what was the number Dr. Shealy said about for Pygeum, the third one?
50 milligrams once a day.
Okay, got it. Okay, yeah, that's all. I got the idea that.
Amit, are you finding that this is something that is becoming talked about among your associates, friends, peers, etc.?
No. I think people are living, as I say, merrily ever after. So I think they are living blindly, and your term of GDP is very apt. So that's in many spheres of our lives, so to speak. So I think people are not worried about that.
Okay. Well, let me be a little bit graphic here. In the good old days, when I used to go to Sam's Club, they have a men's room and a woman's restroom, and they have urinals hanging on the wall. And one of a couple things is happening. Either there's a contest when the guys try to see how far their stream will go between several feet away from the urinal and the urinal, or they are in a hurry to get to the urinal and they are leaking on the way to it, or they can't shut off the flow. But whatever the case may be, or whatever the reason is, there's pee on the floor, and it's within I would say a foot away from the urinal. So if you can't pull up to a urinal with your feet pretty far apart, you're going to be standing in pee. Dr. Shealy, is that symptomatic of, well, it could be carelessness too. Is that indicative of a urinary problem like an enlarged prostate? Do you think that could be what some of this is? The pee on the floor?
Oh, I personally consider it carelessness, but
okay.
But obviously, if one has great urgency and can't make it once you get it open, maybe that's one of the reasons. I haven't actually ever done a survey of men to find out.
So you can turn to your left or right and say, so what's the big deal? I mean, were you in a hurry? Amit, have you seen the evidence of what I'm talking about as well?
Yes, actually, I have even seen a small sign, say an obscure restroom, about some snide remark on those who cannot aim properly. So, like separating men from boys, so on and so forth. So, you are right that there is failure or carelessness in aiming and keeping the floor clean. But I know, I've heard that this pasteurized and homogenized dairy is also a suspect in early or eventual prostate growth, but that may be a difficult topic to handle. It's just hearsay, so nothing medical I have heard, but I have heard that dairy is also not good for prostate health. That's all at this time.
Dr. Shealy, your comments about dairy and enlarged prostate.
About what? I missed a word.
Amit was asking, is there a link between dairy products and an enlarged prostate?
Not in general. Now, there are people who have allergies to milk products of all kinds, but I don't think it's the common one. I don't think it's the cause of benign prostatic hypertrophy or the cause of urinary urgency in most people.
Thank you. Thank you, Dr.
Dr. Shealy, what is the first symptom of an enlarged prostate?
I suppose the first is urgency and having to go more often than you're accustomed to. In other words, the bladder doesn't hold as much.
Mm-hmm. Okay, and why does the bladder not hold as much? Is the prostate enlarging and impinging on the space
it's actually pushing right up into the bladder. It's actually the bulge of the enlarging prostate goes right into where the bladder was, and it just keeps it from filling. In other words, the normal bladder, can hold, up to 6 or 8 ounces of fluid, but it can get to the point where you can't hold more than 100 or less.
When you say 100, you mean 100 cc's?
Yes.
Or ml, 100 milliliters?
I'm sorry, 3 ounces mostly.
Okay, so, all right. So for Amit and those who are wondering, do they have an enlarged prostate, is one way of figuring this out to use a measuring cup and urinate, and this would be guys, into a measuring cup. When you feel like I really got to go, urinate into that measuring cup, and based on the volume, is there a way that we could say,
if you can't urinate 8 ounces, you're beginning to have trouble.
Okay.
I see.
So guys, get that measuring cup out.
That's a very helpful recommendation, because all I've heard otherwise that in order to get an enlarged prostate diagnosed, one has to go to a physician's office, and I think they have to put the finger in the anus and palpitate it and then find out if it is large or good enough or something like that.
That is the easy way to make the diagnosis. And also when you do a rectal exam to examine the prostate, the hardness of it, if it feels like a stone, that's a worry about cancer.
I see. Got that. Thank you, Vincent, and thank you, Dr. Shealy.
Well, Amit, it's our pleasure. Thank you. Do you have any other questions about health that you'd like to ask? Because this was very important.
That's all at this time. I think Dr. Shealy has already given us enough hints to keep our hands full if we are disciplined enough to work on them.
I have one other question that I would like to ask, and if you wouldn't mind staying with us just for the answer from Dr. Shealy. This was something that I wanted to ask in general. So, Dr. Shealy, has there been a study or is there any information regarding clusters of prostate enlargement? Meaning, are there certain areas of the country, or are there certain groups of people, or are there certain conditions that would cause the enlarging of the prostate?
There may be, but I'm not aware of it.
Okay. The reason I ask that is when I lived in Virginia, people would have kidney stones, and they linked that to drinking orange soda, and there seemed to be some kind of a correlation.
Now that one I can understand. Interestingly, if you take a lot of vitamin C and do not take B6 with it, that can cause kidney stones. In other words, anytime you go above 100 milligrams of vitamin C, and of course I recommend 2,000 milligrams, you must have at least 50 milligrams of vitamin B6, or it can lead to kidney stones. Okay.
So and I take a lot of vitamin C, specifically yours, which is called Youth Formula. It's 2,000 milligrams. So I'm taking 2 grams of vitamin C each time. And before I started the broadcast, I took 4 grams. I took 2,000 milligram capsules of vitamin C before the broadcast. So I need to take 50 milligrams of B6.
Well, you get that in my essentials.
Okay. And I take right next to the Youth Formula is the essential. So do I just take one?
Two, I would take 2 of those when you're taking that much.
Okay. Okay. Well, I take even more than that. I probably take between 4 and 6 of your youth formula spread out throughout the day. So
yeah, that's fine.
And so I'm okay with it, with 2 essentials.
Yes.
Okay, class, what we're talking about is Dr. Shealy has 2 products that I really like. And I have an interesting story to tell you about that. And so I take it multiple times a day. So one of the products is called Youth Formula. It's Dr. Shealy's Youth Formula. It's 2,000 milligrams of vitamin C plus 1,000 milligrams of MSM plus beta glucan 3 milligrams. So that's in one capsule. So I take that multiple times per day, typically between 4 and 8 of those a day. And then I take his Dr. Shealy's Essentials, which is his multiple vitamin. And the story that I wanted to share with you about that was our son was coming to town, and we were running low on your supplements. And when I say low, if I've got less than a month's supply, it bothers me. So I asked our son who was going to town if he could stop off to your office and buy some Youth Formula and Essentials. And he said, sure. And so we called and said that we're coming by. Could they have could they have it in a bag for us and take the credit card, etc. And they said they'd be glad to bring it right out to the front door. Well, what happened was our son was bringing eggs from our farm to your office. And he was bringing the eggs, and one of the gals said, could you add another one for me? Sure, no problem. And then another gal came around the corner and said, can you make that 2 more? And then another gal came around and said, can you make that 3? So I don't know if you knew that story, Dr. Shealy, but
I do not know that story.
obviously the staff at Dr. Shealy's office in Springfield, Missouri, really like farm fresh brown eggs, and they realized the difference. So very good. Amit, anything else you want to ask?
That's all, Vince, at this time. Thank you.
Amit, thank you so much for such a wonderful subject to share with our class. Thank you again.
Bye.
Kathy, you're up next. Dr. Norm Shealy's with us. Kathy, welcome.
Hi, Vince. How are you?
Hey, really well. I'm sorry I missed your call last night, but we can talk this evening. But
sure.
Please continue. I'm sure you've got a question for Dr. Shealy.
Yes, I do. Dr. Shealy, I don't know if this is something that you could give me help on or not. I have a 8-year-old black lab, and about 4 or 5 days ago, she had like a little puddle of urine when she got up. And then the next day it was quite a bit less. And I thought it was clearing up. And I noticed it was starting a little bit more last night, where I saw an increase again. She's never had any problems like that before. A couple things I'm wondering that possibly could have contributed it, unless she's got like a UTI. But I am going to take a urine sample over to the vet in a little bit and have him check it just to make sure that if that's what it is. I had made her some food on, I want to say it was probably right after Thanksgiving, and I made her like turkey soup, which I cooked the carcass, and I strained off as much fat as I could. But I'm wondering if the increase in the fat would have any part of the dietary thing. But I haven't given her that since, for probably about a week now.
Yeah, I don't think that the fat would interfere with the urine. I would think that would be more a bowel problem. But I'm not a vet, so I'm not an expert in that field. I've never had that problem with many dogs that I've had all my life. But it apparently is not uncommon. And I unfortunately think it does need a vet's opinion.
Yeah, I'm gonna take her over. I did a little research, and I've been giving her a tablespoon of apple cider vinegar in her food, and I've increased her fluid so that hopefully she can flush it out if it is a UTI. And I've read a little bit about other things that you can add, like I've got some Greek yogurt that's got the lactobacillus in it and a couple other products, but I just wanted maybe you or Vince, with you guys having dogs like I've had my whole life, if you had any advice for me.
Well, Kathy, I read your email at the beginning of the broadcast, this hour, to Dr. Shealy, and he mentioned D-Mannose, and he mentioned it may or may not work, I believe, if I remember correctly. Dr. Shealy, would you like to review that point with her, D-Mannose? And
well, yeah, if it's a urinary infection, it may work in dogs. It works remarkably well in about 95% of people. D-Mannose. Now, I have no idea how much you give a dog, but a teaspoon of the powder would probably be just as good for a dog. But that's what a person takes, and it will actually treat about 95% of urinary tract infections without antibiotics.
Yeah, I would like to stay away from that if I could. I guess my question is, let's say it is a UTI, and I believe they typically give them Bactrim. But if I could try this first, would you think that would be a safe way to go?
Well, it certainly can't hurt. And if it doesn't work within a couple of days, then I would still go to the vet.
Okay. And do the antibiotics if this doesn't work, right?
Right.
Okay.
Dr. Shealy, I have a question for you regarding urinary tract infections. Is there a do-it-yourself kind of a test that we can do?
You can actually get urinary test strips that will tell you. You can buy them at a pharmacy that can tell you. You just dip it into the urine and find out if there's an infection.
That sounds great.
I mean, they're certainly urinary test strips that will give you the answer.
And do you think that would work for Kathy? Could she just do that?
We're talking about for a dog.
Yeah.
It could work for Kathy or her dog, yes.
Oh, jeez. Kathy, I did not do that. Dr. Shealy did that.
I know. That's funny. Are those the same test strips that you use, like for pH? Like if you're testing your pH, is that the same thing?
It's a different one for pH. It's quite different. It's there's test strips for sugar. There's test for protein, and there's actually one that will actually measure for infection.
Kathy, I just looked.
I found it on the internet. Hold on.
Kathy, can you stay with us through the break? We got some.
A couple minutes, yeah. Mm-hmm.
Yeah, okay. I found some information. I think Dr. Shealy did as well. We'll be right back. Great question, Kathy. Great question. We'll be right back, class. Hour number 2 of USA Prepares. Dr. Norman Shealy is with us. Medical doctor. Kathy in Ohio is with us. USA Prepares instructor. And she's our domestic engineer. And she was asking about urinary tract infections. Dr. Shealy, did you find some information about the test strips for...
There's at least a dozen different companies that make something called UTI, urinary tract infection test strips. Basically, you want to find out whether they're white blood cells or nitrite. Those are indications of an infectious process.
Okay. Kathy, I'm looking at the internet, and Walmart.com has something called Rapid Test. It's exactly what Dr. Shealy is talking about. And this particular jar of tests has 100 tests, 100 tests in it, or 100 count. And there are 14 parameters. So they say that it will detect urinary tract infections, kidney problems, gallbladder problems, and pH. So it's all in this test kit. $13.45. Free delivery if you, it says it's free delivery. So $13.45. I think what you hit upon, Kathy, is something that we all needed to know, and I'm so glad you asked that question.
Well, so basically, if I ever suspected one in my dog or another family member or myself, I could do that myself to see whether or not this was an issue. And then if it was, then maybe try to treat it with the D-Mannose. And if it doesn't clear up, then obviously go and, have it taken care of or get antibiotics if you have to.
Absolutely. Yes. Absolutely. All the way.
Okay.
Kathy,
Dr. Shealy,
I just sent you a link. I just sent you a link to what Dr. Shealy and I are talking about. So you should have it now. And class, you can simply go to Walmart.com and you can type in UTI test and you'll find it. Okay? And it seems, Dr. Shealy, for $13.45, isn't this something else we should have in our medicine preparedness cabinet?
It's a good idea because, don't bother going to the doctor if it's not a urinary tract infection. Unless it persists or is associated with fever or something, yes.
Okay.
Dr. Shealy, can I ask one other quick question about that?
Yes.
What if it's a situation, well, first of all, does it seem like does it seem characteristic of a UTI?
Well, that is one of the, it being a female especially, and not a male, because the male could have, even in the male, it could be benign prostatic hypertrophy in the dog. But, I think it's worth checking.
Okay, and if it's incontinence, then that's a whole different issue.
That is a very different issue, yes. And that one, I don't have the foggiest idea how you handle that on a dog.
Okay. I appreciate it, Dr. Shealy. Thank you, Vincent.
Well, thank you, Kathy. And Kathy, I just checked it out, and that $13.45 free delivery, so you don't have to have a minimum order, as far as I can tell, to buy this test kit. And that's the Walmart one that has the 14 tests built into the test strip. So you might want to check that out. I sent you a link. So, class, you have the same information and to find that product. Now, I'm not recommending Walmart over any other brand. I'm just saying that's the one I found. It seemed to be the most tests in the jar or bottle, 100 of them. And it sure seems to me that, following Dr. Shealy's advice, that it makes sense to have that on the ready. So if there are symptoms, you can either rule it out or not, right? Very good. Kathy, thank you so much.
Thank you, Vince. Thank you, Dr. Shealy.
Hey, have a great day.
Thank you. Bye.
Thank you. We've got the brightest instructors, Dr. Shealy, and they're always thinking about ways to do things themselves, become responsible for themselves. What a great way to go. I certainly endorse that. Gargling with salt water, Dr. Shealy, that's something that my dad, if I had a sore throat or a cough when I was growing up, my dad would say, okay. And he would take a pan, heat up some water on the stove, mix some salt into it, and he would make almost a super saturated solution. By heating the water, you can dissolve more salt in the water than you can at room temperature. So, he would super saturate, and I would gargle with this very strong salt solution. And it seemed to have a great impact in curing this sore throat. Now it wouldn't happen immediately, but within a couple of days it'd be gone. Dr. Shealy, what are your thoughts about that? And are there any concerns for people who are avoiding salt?
Well, apparently it's very common. I've heard of it all my life. I have never have used it. I have to admit, sore throat is a rare event for me, but they are recommended by a number of physicians, and the only contraindication would be somebody with severe, hypertension.
Mm-hmm. So is hypertension a synonym for high blood pressure?
Yes.
Okay. And because I've heard both, and I've, of course, over the years, and I just wanted to make sure that I understood that hypertension is high blood pressure. Okay, so that leads me to another question, Dr. Shealy. Are there foods that cause high blood pressure? So, for example, your blood pressure is doing just fine, and if you eat this one thing, it will cause your blood pressure to increase significantly. What are there such foods?
Well, rare. Obviously, there are people who are allergic that could have that kind of reaction to, almost any kind of food if they happen to be allergic to it. And salt. In other words, people who have hypertension can't tolerate as much salt as someone who does not. That is, it would cause the blood pressure to go higher. But other than that, it's not the food, it's stress. It's always total life stress.
All right, so stress. Can you define stress? For example, Dr. Shealy, at 9 o'clock in the morning, Monday through Friday, I will click on one of the screens. I'll be prepared to click on the screen to connect to GCN. And I connect at roughly 9 o'clock in the morning, maybe a couple minutes later. Now, by doing that, I am now in a position where I have to deliver. I'm on stage. People can't see me, but I'm on stage. Is that stressful? Would that normally be considered stressful?
Mild. It depends on your attitude towards it. If it's something you enjoy and expect and don't feel as if it's a struggle, it's not stressful. Everything is attitude.
Okay, well, I don't look at it as, oh no, don't make me do it. It's not like that. I enjoy doing it. So, that's why I was asking.
No anxiety over it, it's not stressful.
Okay. So in the summertime when people, look out the window and their lawn is growing and if they enjoy cutting the lawn, meaning, let's say it's one of those riding lawnmowers, would that be considered stressful for someone who enjoys it? Or would that be just...
It probably would not be stressful unless, they run into trouble.
Okay.
If there's engine trouble or motor trouble, whatever, that becomes an instant stress.
Now, for me, driving is a pleasure. Driving in bumper-to-bumper, cutthroat traffic is not a pleasure. So that would be stressful, yes? Driving in... Okay. So, class, that may help you with some of the clarification. All right. So, typically, are there foods? If there aren't foods that really dramatically jump blood pressure higher, are there foods that lower blood pressure?
I don't know any food specifically. Interesting, the things that lower blood pressure specifically are adequate B complex and vitamin C and taurine, the amino acid taurine. That combination will lower blood pressure in about 90% of people. In fact, I can get almost 99.9% of people off all antihypertensive drugs safely without any drug in the world.
Okay, vitamin C, taurine, and what was the other one? B complex?
Essentially B complex. Essentials, youth, and taurine.
Okay. So class, if you have blood pressure that's higher than you think it should be, or higher than it should be, vitamin C, taurine, and B complex. What is you mentioned vitamin C. What would the dosage be for those who, and I'll bet you there are a lot of people who have high blood pressure. It seems like the older I get, the more potential there is for me to have higher blood pressure.
Well, about 45% of all Americans have chronic hypertension.
Mm-hmm.
And on 3 antihypertensive drugs, you have a 40% chance of it controlling your hypertension and a 100% chance of it causing chronic fatigue and erectile dysfunction if you're a male.
Well, I know a guy who had hypertensive drugs. I think I'm trying to lisinopril. I think that was one of them. Another one was, trying to think of some of the other ones, and this guy was older than I. And, he was tired. And, he had erectile dysfunction as well.
Oh, yeah. Antihypertensive drugs are among the worst in the world and the least effective. You know, a 40 to 45% chance of effective with 3 different stupid drugs.
Mm-hmm.
It's crazy.
Mm-hmm. What would be the dosage that you would start someone of average weight, average size, and let's say 50, 60 years old who is not consuming vitamin C, taurine, and B complex? What would be the dosage that you would start them off at?
4 of the youth formula, 2 of the essentials, and depending upon the severity of the blood pressure, anywhere from 3,000 to 6,000 milligrams of taurine. 3,000
to 6,000 milligrams of taurine. Okay. Is that once a day or?
By the way, magnesium lotion.
Okay. And magnesium lotion. All right. So the 3,000 to 6,000 milligrams of taurine, is that once a day?
You can take it once a day, but it's probably a little bit better to spread it out. Take it 3 times a day.
Okay. So that, I guess what you're saying is that total dosage of 3,000 to 6,000 milligrams of taurine, divide that to 3 times a day. So, for example, the 6,000, you would take that 2, and 2. 2,000,
right.
2,000, 2,000. Okay. Very good. And we'll be right back with Dr. Shealy. Class, Dr. Shealy's with us. And if you would like to call his office, you can use the same number that I use. That's 417-351-5221. 417-351-5221. I've got it memorized. And so that's the number I call if I'm buying supplements and if I need to talk to Dr. Shealy. And I suggest that this is not a commercial. I suggest that if you have a condition and it's not working so well and you'd like additional advice and counsel, that you place that call. And let me tell you what my experience has been. And Dr. Shealy, please feel free to correct me if I'm wrong. But I was emailed a questionnaire to fill out that deals with stress. And before talking with me on my telephone consultation, your office had me fill out a general questionnaire about health, about stress levels. And this is the kind of thing that'll probably take you 15 to 20 minutes, maybe even a half an hour to fill out. And it will guide you through things that you might not have thought about regarding your health. And then that can be sent back to Dr. Shealy, and he will review that prior to talking with you on the phone. So he already has the beginnings of your medical chart in front of him before you even say hello. And that will cut right to the chase and help him with your diagnosis. Dr. Shealy, did I describe that correctly?
Absolutely. You know, it does save. The average person actually takes up to 30 minutes to fill those out, but we schedule a minimum of a half hour or a full hour for more complicated procedures. And right now, at least 2/3 of all our new patients are by phone or Skype or Zoom.
Okay. And have you determined that there is some kind of common thread that is going through many of your telecommunications type consultations, whether it be Zoom or telephone or Skype or whatever? Are there similarities that or maladies that people are having that are occurring more commonly than
well, anxiety is the top of the list, I think, today. It used to be more chronic pain and depression, and it still is those things as well. But there's no question that the fake-ademic has markedly increased anxiety. And And that, of course, affects everything because, well, that's the number one major reaction to stress is anxiety.
Can you describe for our class what that means? Does that mean the equivalent of a chicken running around with his head cut off? I mean, people
well,
not knowing what to do.
Extreme anxiety.
Right.
And actually, I see people almost that bad, or talk to people almost that bad. And obviously, the number one thing, if you can't make a physical change in whatever it is, you must learn to detach. And that, of course, is why at the top of my list for almost everybody is autogenic training. If people will give themselves 36 minutes a day and do it every day for a minimum of 1, but preferably 3 months, it will reduce stress in 90% of people. The problem is getting them to do it.
Dr. Shealy, it's really simple. So for those who are interested in autogenic training, you can go to Dr. Shealy's website, normshealy.com, NORMSHEALY.com, and you can type in autogenic, AUTOGENIC, and it will take you to the page, and there is a free page where the autogenic training is listed, and you can just repeat to yourself what you read on that screen. You might want to print it out so you can have it in front of you for ease of use, but it's a really simple thing, and you can do it. And
you can also download the MP3.
Okay. And how do we do that, Dr. Shealy?
Well, it's free. If you sign up for my newsletter, you can download the Autogenic Focus.
Dr. Shealy's with us. MD, PhD times 3. Dr. Shealy, autogenic training. For anyone who wants to go to your website and find the autogenic training, it's a very simple class. Type in Norm space Shealy on your search engine, NORM space SHEALY. Then I put a comma in there, and then I type in autogenic training, AUTOGENIC space training. TRAINING. And up it comes with the text of the autogenic training. And it's, it says, start this way. Assume a comfortable position. A reclining chair is ideal. Close your eyes. As you breathe in, say slowly to yourself, my arms and legs. As you breathe out, you say, are heavy and warm. So there's the text. There's the procedure. And it's free to read. And Dr. Shealy just mentioned that if you would like it gratis, and you sign up for his newsletter, you can get the download, the MP3 for free. Did I say that right, Dr. Shealy?
Absolutely.
Okay. And how long does it take for someone to do the autogenic training per day?
18 minutes twice a day is the ideal.
18 minutes twice a day. Now, by doing this, you are sort of hypnotizing yourself, aren't you?
It is a form of self-hypnosis, self-regulation, self-control.
Mm-hmm. Sometimes I find that my heart rate is a little higher than I'd like it to be. And I just close my eyes.
This will lower the heart rate and the blood pressure almost instantly.
Right. That's what I was going to say. So, class, you might want to get something that I have and I've recommended. It's called a pulse oximeter. And typically when you go to visit a doctor in person, or the nurse practitioner or the nurse will put this little device on your, it's kind of like a clothespin almost. And it has a digital display. It runs on 2 AAA cells, and it will determine your heart rate and your oxygenation of your blood by simply clamping lightly onto the tip of one of your fingers. And I have one, and it's one of the things that I'd like to know from time to time what my oxygenation is, the family member's oxygenation, their heart rate, etc. And it's less than $20. And so when my heart rate increases, I can do autogenic training and bring it right down. And of course, I take a big glass of water before I do that. And I think that the combination is great, Dr. Shealy. Any comments about the big glass of water?
Well, most people don't drink enough water. But, of course,
Okay.
in the city, you shouldn't drink any city water if it's fluoridated.
Well, and it's more than that, Dr. Shealy, isn't it? Because if you look at the bottling plants, they're not sitting on top of a well. They are typically in the city, and they're using city gin, right?
And at least half of them, of all bottled water, at least half of them have fluoride in it.
Well, and so, class, if you want to check this out for yourself, next time you read the label, whether it be online or in the store, and you look at that jug of water, a lot of times it will say, filtered municipal water. That means, they take the big chunks out with the filter, and it contains fluoride and chlorine. So take a look at it, and that's what bottled municipal water is. That's different from aquifer water. That's different from well water. That's different from artesian wells. This is city modified water. Now, Dr. Shealy, we're talking about foods and lowering blood pressure. One of the things that I even have it in the studio, garlic capsules. And I have found, and I've mentioned this before, that taking these garlic capsules will drop my blood pressure 10 points. Would I be even better off if, any comments on that, Dr. Shealy?
No, it works in a lot of people, yes.
Okay. And does it do that? Does it work by dilating the circulatory system, making the pipes a little bit larger?
I think so, yes.
Yeah. Okay. And what about fresh garlic?
Well,
How much? Okay.
Well,
and when I want to make new friends, one of the things I'll do is take a clove of garlic and kind of chew it.
Well, some people like it, some people don't like the smell of garlic. I actually think it's a pleasant smell and taste.
Yeah. Okay. And is there any concern about, taking, what I do is I take one section of garlic and slice it into little discs, and then I'll, kind of suck on that and chew on that and then swallow it. Any thoughts about that? Is that a good practice or a risky practice?
That's fine.
Okay. One of the things that I have on my list to discuss today is antibiotics and probiotics. And we, over the decade that we've been broadcasting, we've been talking about probiotics and, good bacteria, and antibiotics that kill cells. What about when someone's on, let's say, an antibiotic, let's say they're on it once a day for 7 days. When would be the right time, if there was a right time, to take a probiotic? So let's say, let's start with 12 o'clock. Let's say the person for 7 days is on a course of antibiotics for whatever the reason. Should that person who is taking it once a day at 12 o'clock noon, should that person take probiotics at some time during the day? Okay.
It's far away. If you're taking the antibiotic twice a day, try to take it halfway in between. If you're taking it 4 times a day, well, take it as far away as you can. In other words, you might only be 2 or 3 hours apart, but don't take it within at least a couple of hours of the antibiotic.
Okay. So if there's a 24-hour day, and all things being optimized, if a person is taking an antibiotic at 12 o'clock noon, then they'd want to take the probiotic at midnight. Is that right?
Yes.
Okay. And it might be more pleasant to take the antibiotic at 8 o'clock in the morning and then taking the probiotic at 8 o'clock at night.
Yeah.
Okay. And what is the reason for that, Dr. Shealy? Does the antibiotic collide with the probiotic, and does the probiotic kind of neutralize the effect of the antibiotic? Is that what the problem is?
Well, actually, the antibiotic can kill the probiotic. That's the big problem.
Okay, so the antibiotic is the big gorilla.
Antibiotic be able to kill the bacteria, but if you take the probiotic with, at the same time, the antibiotic is actually going to kill the probiotic bacteria themselves.
Okay. How about antibiotics and yogurt? Okay, so we're talking about probiotics being these capsules, for example, or some kind of a pill form of probiotic. What about yogurt? Does the same thing apply? Spacing yogurt?
Absolutely. And now, plain yogurt is fine. Don't waste your time and money taking the flavored ones because they got sugar in them.
Mm-hmm.
And the sugar actually is a very negative influence. So if it's got strawberry or whatever, don't buy it. And actually, plain Greek yogurt is much stronger than regular yogurt.
Okay, so if someone were taking Greek yogurt, let's say as we'll use the term loosely, medicine, how much should that person take per day? So, for example, let's say you can get the large size, let's say 16 ounces. How much of that would you recommend taking, and how often?
4 ounces once or twice a day.
4 ounces once or twice a day. Okay. What I've been doing is I'll have my own, and I'll take a clean tablespoon, and I'll have a tablespoon or two multiple times per day. Is that
That's
okay?
Fine. That's okay too.
Okay.
As long as you're at least a couple of hours away from the antibiotic.
Okay. But if a person is not on an antibiotic...
Oh, well, then you can take it any old time.
Okay. Are we better off taking it more often, smaller amounts more often, or better taking it, a larger amount once a day?
That, to me, is an individual, idiosyncratic, normal variation.
Okay.
We are very, very unique in that kind of thing.
All right. Beta-glucan. What can you tell us about beta-glucan? What does it do?
Beta-glucan strengthens your immune system.
Mm-hmm.
It's that simple.
Okay. And how much should a person who is, we'll say, of normal health take per day?
Well, actually, 500 milligrams is a good dose.
Okay.
Now that's, if you're adding that to just for general health purposes.
Mm-hmm. Okay. What if someone is somewhat compromised and wants to boost their immune system?
Well, as long as you're not, remember, there's all the individuality things when it comes to foods.
Mm-hmm.
Some people will do well taking a cup twice a day. Other people will do better taking, 2 tablespoons to 4 ounces twice a day.
Okay, you're talking about, generally speaking, foods and how to eat them, okay?
Yes.
Okay. Liposomal vitamin C versus regular ascorbic acid vitamin C. What is the difference?
Well, actually, ascorbic acid is vitamin C.
Mm-hmm.
St. George was the discoverer of vitamin C in that form. That is a water-soluble form, but there is a fat-soluble or liposomal vitamin C. It is somewhat better tolerated by the gut or the intestine in larger doses than the ascorbic acid. Now, almost everybody will tolerate up to 2,000 milligrams of ascorbic acid, but people begin to get bowel troubles with frequency or urgency in bowel at 5 grams and up. But with the liposomal, most people can actually get up to 8 or 10 grams.
Okay, and so is for the layperson, is the difference fat-soluble liposomal vitamin C versus water-soluble ascorbic acid vitamin C? Is that really how we should look at it?
The difference is tolerance in the bowel.
Mm-hmm. Okay. So if you cannot tolerate a large dose of vitamin C, go to the liposomal vitamin C.
Exactly.
Okay. What is inflammation, Dr. Shealy?
Well, now that is a possible abnormal, if you will, reaction to anything. Mm-hmm. In other words, it is an irritant, and it causes irritation, inflammation, meaning it can, if it's on the skin, it's going to look red. In the bloodstream, it increases the white blood cell flow. numbers of white blood cells. The white blood cells go there to quiet it down, to try to stop it.
Okay. When we come back, I have a question. I was watching Combat. It's a television series from the 1960s. And when one of our guys would get shot, wounded, they would sprinkle sulfur powder on the wound. Can you talk about what that was, why they did it, and do we still do that? We'll be right back. So as I was mentioning, I've been watching this television series, Combat, C-O-M-B-A-T, exclamation point. You can buy it on, used on eBay. You can buy it new. You can get it at Amazon.com. You can watch it for free, as David in Illinois advised us, on YouTube. And Dr. Shealy, when it's a series about a squad of infantry men, a rifleman squad in France toward the end of World War II, and these guys would get shot and wounded, and they would carry these packets of sulfur or sulfa, S-U-L-F-A, with them, and when someone was wounded, they would sprinkle this sulfur or sulfa powder on the wound. Do we still do that?
Well, I don't think it's done very often. However, there's a long-standing historical use of it for that purpose, and it does work. Apparently, it is anti-inflammatory, antibacterial, and even antifungal.
Mm-hmm. So this was something that they would sprinkle on the wound. The medic, if he was there when the wounding happened, he would sprinkle it on, or the guys would carry their own. And one of the things they mentioned was the German troops, the Nazis, who we were fighting, didn't seem to have as much of it as we had. So our troops, the GIs, had sulfa or sulfur in greater quantities for tending to their own wounds. And it looked like they actually had a pouch that contained this on their ammunition belt. So right in the front, where they could get to it really quickly, they had these packets. Dr. Shealy, is there a series of drugs, or are there drugs that make people more anxious, more combative, that have been unleashed on unsuspecting patients, that people are consuming drugs that really make them angry and hostile? You know, the equivalent of...
Well, yeah, I don't know any mood drug, that is, whether it's antidepressant or anti-anxiety or what have you, that personally I recommend ever, hardly.
Mm-hmm. Well,
they all carry more negative effects than positive effects, in my opinion.
Mm-hmm. And one of the things I was thinking about is steroids. And there's a term roid, as in steroid, rage, as in road rage. And I'm sure you've heard that term.
Oh, yeah.
Is that true? That
no
steroids?
Question about it.
Mm-hmm.
In the body, when you actually put out an increased amount of adrenaline, that also puts out an increased amount of cortisol.
Mm-hmm.
They go together.
Mm-hmm. I have a copy of your book, 90 Days to Self-Health, Health. I mentioned it hour number 1, the beginning of the broadcast. And I was able to find a copy used on the internet. And you might find this interesting, Dr. Shealy. You know, you wonder who buys your books when you write your books, I'm sure. Like, who reads these? Well, I can tell you for sure, and I didn't know this when I was buying it, that, and this has been out of print, right, Dr. Shealy, 90 Days to Self-Health?
Well, actually, it is still available. We've reprinted it. Okay,
I wasn't aware of that. Okay. Well, I ended up getting one used on eBay, and there is a embossing stamp. Now, class, I'm sure you've seen the old stamps that the notary public would have, and they would press this stamp into the paper, and it would indicate that the notary has stamped it and it's official. Well, there are people who have these kinds of stamps, and some people imprint their books with them. And I have a copy of your book, 90 Days to Self-Health. It's the third printing, which was around 1980. And it is, and I can't, because this stamp is so old, I can't read it exactly, but it is it says library, and it's on the front cover. It's a paperback. Library of, and this man's name, Donald something, MD. So, a medical doctor owned and thought enough of this book to stamp it so that if it started getting legs and walked around, it would return to the owner. And he stamped it. So I just want to let you know, there's doctors read your books. And I know several doctors who buy your books and have read them. So I just want to let you know.
You can actually get an e-copy of it for free on my website.
Okay. Well, I can't beat that price. How do they do that, Dr. Shealy?
Well, again, you go in and you sign up for my free email newsletter, and you can download either 90 Days to Self-Health or Autogenic Focus.
Okay, class. So that would be normshealy.com. Go to Norm, NORMSHEALY.com. Normshealy.com, and you can download it for free. Okay, and let's see. Those are most of my questions for you, Dr. Shealy. I want to tell you that I am taking lecithin many times a day, and I actually really like the taste of it. Lecithin granules. I take it with yogurt. I stir it in there, and I add it, and then I add more, and then I add more. I really like it. Is there anything else that you recommend lecithin granules on as a supplement besides yogurt, Dr. Shealy?
Well, you can put them in any kind of liquid. They don't have much flavor there, but at least they're good for you.
Yeah, there you go. So, Dr. Shealy, thank you so much for being with us. normshealy.com, NORMSHEALY.com. Thank you, Dr. Shealy.